Hello, you are listening to Vlog Music by Summer Rain. Again, this is on YouTube, royalty-free music. I always love to go on to YouTube, royalty-free music, in order to promote, up and coming artists. Welcome to today's Are You Covered Enough program. It's going to be very short. I just wanted to give some quick information in regards to, again, Monday. It is such an amazing day. Monday is when the marketplace reopens, right, for special enrollment. And I figured it was, I know I talked about it on the earlier HAPS show that we did on the Are You Covered Enough podcast. But I wanted to talk about it again because with everything that's going on politically, this information may be getting missed, and this information is actually more important to people's livelihoods, right, than what may be going on right now in Washington, D.C. with impeachment and I guess basically non-impeachment from what I'm hearing. Impeachment, but wasn't convicted or whatever. Anywho, this is actually more important to your life, right? Especially if you have lost your job in the pandemic and you don't have healthcare coverage, or you have a pre-existing health condition, right? That if you try and get coverage, like private coverage, it's either very high or you can't get covered at all because they're looking at that pre-existing health condition. So I wanted to come on and I wanted to do another HAPS about this. So who are we? Again, I always like to let people know who we are. MRW Solutions Group. We are licensed life, health, and wealth management consultants for the great states of Michigan, Ohio, Texas, South Carolina, and Virginia. If you looked at my last show, what I did when I got to South Carolina, I was like, South Carolina. It goes back to not really that old. I think it's probably like about maybe 6 years old by P.D. Powell. And that was a rapper, and he was like, South Carolina. And I just love saying that. But either way, so if you're in Michigan, Ohio, Virginia, Texas, and South Carolina, we can cover you at MRW Solutions. I wanted to talk about what makes us different, right? Because you may see, and I'm actually going to be pulling up an article that I saw here, and it makes it very, very confusing for people, because sometimes when journalists write these type of articles, they don't really know what they're talking about. So with us, right, we are certified in the ACA marketplace. Okay, what does that mean? In other words, we're licensed, right, for being able to do health, life, and wealth, right, accident, right? And then on top of that, we had to get a separate certification, right, just to be able to navigate and give people options for the ACA marketplace, which is the Affordable Care Act marketplace, which is also known as Obamacare, right? That's what a lot of people know it as. So I like to emphasize that because when I show you this article, some folks are going to read this article and be like, oh, well, I just have to go to Marketplace in order to get my coverage. No, actually, you don't. You can go to Marketplace if you like, the ACA Marketplace, but you can also get covered from a license. And I keep saying that, license. They should be able to give you their license information. If you want to, I always say, if you want ours, I'm going to give you numbers right now. Our license, our state residential license is in Michigan, and it is 196-05151. That is my state residential license. I am basically the licensed agent, and I work, obviously, for the consultant group of MRW consultant group, and that's how we can get people covered. right? So I'd like to make sure that that is clear, especially for this article that I'm going to be pulling up real shortly here. That kind of makes it very unclear. So if again, you need healthcare coverage, this is what we do, right? We can just shop that marketplace for you. We can make sure that the coverage is correct for your budget and what it is that you need. And if you need a, even like a deductible replacement plan, and that means like, okay, just say you got a deductible, you go to the doctor, oh, I got to pay, I don't know, $500 when I go to the emergency room. Well, we have plans that are available that can help, pay you back for that. Now, a couple of things I always like to make sure I emphasize, because a lot of times people get this confused, right? When we do healthcare consulting, like for ACA or, other consulting that we do for life insurance, etc., it doesn't cost anything, zero, for you to come and basically figure out if this is something that you want. We basically will do that for you. It doesn't cost you a dime. That's the consulting part of MRW Solutions Group. And only cost that you are going to pay ever is for whatever plan that you choose, if there are costs associated with that, your monthly premium, etc. That's it. That's the only cost that you will pay. You don't pay us to do the searches for you, right? But we do that because that's the consulting aspect of MRW Solutions Group, right? As licensed insurance agents. So I'd like to make sure that that is emphasized, because a lot of people, maybe in the next coming days or even sooner, that they may say, hey, yeah, I'll shop the marketplace for you. Give me $50. If any agent is asking you for extra money outside of what that plan is for the marketplace, hang up the phone. Seriously, just hang it up. Like click, or if you're on a computer with them, stop the Zoom, because they should not be actually you for anything extra. Okay. So with that, I wanted to show real quick this article, because it makes it so confusing. I'm like, oh my God, I wish people would not write articles if they don't know what they're talking about. So let me see if I can present this. Let me see here. I need to do application window, Chrome tab. All right, yep, here it is. Okay. So, and I'm hoping you're seeing it. So, the registered staff report put up something, the Richmond Register, I don't know, 7 hours ago. And, I guess it's from Kentucky. And so they make this very confusing for folks that may read this article. So I'm going to go through it and I'm going to break it down, because it literally needs to be written down. So, okay, according to this, the coronavirus pandemic has left many Americans unemployed and underinsured. Sure it has. In order to give people additional chance to sign up for healthcare coverage, the U.S. Department of Health and Human Services has reopened the healthcare.gov for special enrollment for February 15th to May 15th. Yes. Unfortunately, scammers are using this extra enrollment as a chance to prick people out of money and personal information. The Better Business Bureau stated in a release. Okay, we'll keep going. Anytime the government rolls out a new change or initiative, people understandably have questions and concerns. That scammers take advantage of this opportunity to confuse and mislead victims. The special enrollment period is no exception to that rule. We're going to keep going, because trust me, I'm about to get to it. In the fall open enrollment, BBB.org scam tracker got many reports about scammers claiming to be governmental representatives who can navigate your Medicare or the Affordable Care Act options. Scammers claim to be a healthcare benefits advocate or a similar title. These scammers allege they can enroll you in a better program than you currently have. Their plan is cheaper and you can keep all the same services. To get started, all you need to do is provide some personal information, such as your Medicare ID number. Of course, the call is a scam, and sharing personal information opens you up to identity theft. Stop! This is why I'm stopping, because this is confusing. Because they're talking about, ACA and Medicare, but they're in the first part, they're talking about ACA, and then they're talking about a Medicare ID number. So let me give you the facts, right? And I'm going to come back on screen, because it's just way too much, right? I hope you were able to even see my screen. I was presenting. So issue. And I was presenting. Let me pull it up. Sorry. So this is the article I was reading right here, right? I was reading that one, right? And go back to the beginning of the article, right? Okay. Here is the problem. And I'm going to come on the screen with the article. First things first, there's a difference between the Affordable Care Act and Medicare, but they rolled them all up in one. Secondly, is that the Affordable Care Act, that's the special enrollment period that's coming up to February 15th to May 15th, is completely different from anything that's related to Medicare or any other programs that's associated with Medicare. So you have to make sure you cut that fine line, number one and number two. You got to make sure you do that because otherwise it gets real confusing for everybody. So let's talk about ACA. So with ACA, you would not have a Medicare ID number, so you shouldn't be giving that to anybody, right? And even if you have a Medicare ID number and you're looking and you're shopping with a broker, okay, that broker in most cases has to get what's called a scope of appointment, right? Which means you have to fill out, right? You have to fill that out if you're doing any type of Medicare Advantage. They have to get that scope of appointment where you agree to talk with them about options. That is required by law, right? So no, you don't have to give anybody your Medicare ID. In fact, you should not be giving them your Medicare ID number, period, without like a scope of appointment that you have agreed to talk about options that are available for you. Just flat out, don't do it, right? But that's, again, not ACA. ACA doesn't have a Medicare ID number. So next, let's look into what we were talking about for personal information, because that's the question. First of all, you shouldn't be giving anyone any personal information for like a broker like us or anybody else outside of the following things. I'm just going to make sure you know. Your name, right? Your birth date, or whoever it is that you're covering, their names, their birth dates, and how much that you make per year. That is like all the information that's needed in order to give you a quote. Nothing else is needed. Your social security numbers are not needed to give you a quote. If anyone's asking you for your social security number to give you a quote, hang up the phone, get off the computer. It's not necessary. I just want to emphasize that because this article makes it very confusing, right? In regards to what actual agents, right, that work as licensed brokers or like a brokerage because they have a lot of carriers do. Make that clear. Okay, next. Okay, I'm going back to the article again. Let me see here. Where are we at? So, okay. First, the next thing is changing your plan, right? If you sign up for ACA in Affordable Care Act December 15th, right? Or that was the last day you could sign up. And you before this special enrollment. And your plan is working for you, great. Don't switch your plan. And honestly, I wouldn't want to switch you either, right? If your plan is working for you, and everything's working, you can go to the doctor, you can take care of things. You are basically, you know, you have the right co-pays and you can handle that with your budget, et cetera, et cetera, et cetera. There is no reason for you to change your plan. If you were on the exchange and everything's good, there's no reason for you to change your plan. And so with that, if someone calls you and say, hey, I want, let's look at options. First, I signed up while it was the last open enrollment from November 1st to December 15th, and I like my plan, right? Then there's no reason for you to change it. If you're paying a lot because you wasn't really sure, like, okay, let's say you're paying a very high deductible, $17,000 plus for a family, $8,000 for an individual, and you want to look at options that may be available for you in special enrollment. Again, that's still different, right? And that's different. And you can do that. You can even do that with a broker, but like what we do, like making sure that we sign you up for ACA, but make sure that's the purpose, right? Don't just be like, oh, well, okay, somebody said they can save me more money. you may be in the best plan that you can get, depending if you have a very low premium, you probably are in the best plan you can get. That premium is not going to change even with special enrollment. Please make sure that you're aware of that. Okay, so moving on. And it says also another kind of scam this fall. First of all, it's not fall, it is literally winter. Callers try to frighten rather than assist victims with their health care plan. Well, first of all, should nobody be frightening you? If they are, hang up the phone. In this case, scammers claim that your Medicare will be discontinued if you didn't enroll. Unfortunately, this Medicare advisor can fix the situation if you share personal information with them. First things first. Okay, I'm going to go back with this. No, your Medicare is not going to be discontinued because you don't enroll with someone that calls you on the phone, or better yet, if they don't change your plan. If they tell you that, hang up the phone. Hang up. But again, we're talking about ACA, so I'm still confused why Medicare is here. Okay, and then it says also, watch out for similar scams in this new open enrollment period. Healthcare.gov does legitimate help figuring out which health plan for you. These people, sometimes called navigators or assisters, are not allowed to charge for their help. Neither can we. And if someone asks you for a payment, it's a scam. True. If you also need to contact them, you also will need to contact them. They don't call you out of the blue. Hold on. So sometimes people say, they go in, they put in something like, okay, I want to shop for healthcare coverage, right? And that is called a lead. And then someone may call you back and ask you about what you put in about looking for healthcare coverage, right? In that case, that's not a scam either. They're actually calling you to see about what it is that you put in for the information about wanting healthcare coverage. That's where this article gets confusing. I just wanted to make sure I pointed that out. So that's different. That's different. Now, no, again, they should not be charging you to shop the marketplace for you. Nobody should charge you to shop the ACA marketplace. Same as Medicare. No one should charge you to shop if you are looking for Medicare plans and stuff. Nobody should charge you. Okay? So I just want to point that out because the point, it kind of started weaving and bobbing. And sometimes people read these things and they take them at face value without really knowing everything about it, right? So I wanted to explain to you everything about it. So I'm really happy I was able to do that. So we're going to get off this article. And so that's number one. So now we know that, and I want to put up who we are, right? And it'll come through the screen shortly. Again, we are, certified with ACA to be able to shop the marketplace for you for coverage. That is what we do, right? And we want to make sure that you, right, get the proper coverage and know you're not going to charge anything. So it is so critical that if you, right, need healthcare coverage, that you look at getting covered. I don't know why this is not coming up. This is a little issue. Push the program, right? So our information, right? And I'm gonna push this again. Our information is right there. That is us, MRW Solutions Group, right? If you want to look at, plans on Monday, mrwsolutionsgroup.com. Now, you can also, again, you can book an appointment with us, again, to look at it. It doesn't cost you anything. And no, we don't need your social security number. I told you pretty much what we needed. Names, birth dates, and how much you make, and then we can figure out what your coverage is. And that's all we need. We don't need any more personal information. So to book a healthcare consultation appointment for ACA, you can go on to this website and push the program in order to basically do that. Just on to our MRW Solutions. Yep, there it is. And just go to that link. Or just go on MRW Solutions Group and say book online, and it does the same thing. Okay? So it is so important. I want to push this article to you real quick. It is so important that people don't go past this. I mean, I was just talking to you, and I spoke about this on the previous program. I was getting my oil change, and I was talking to a young man who is going to be calling me on Monday. And we were talking about basically, let me close that. We were talking about basically, the fact that he didn't have any healthcare coverage, right? And I was like, okay, well, we got to fix that, right? And he's going to be calling me Monday. We're going to be looking at his situation and trying to get him covered. I'm really excited about that. So also, let me push this screen up. All right, I'm pushing me back because I need to. This is where, again, this is basically about CMS to launch outreach efforts. Well, this is an outreach effort. And the reason why is I want to make sure people know about this. And everything that's been going on, you look on the media right now, it's like impeachment heaven, right? Or whatever. When you have people that actually have needs, right? Impeachment is one thing, people's healthcare needs is another. And honestly, they're not going to probably start maybe talking about this until Monday. By then, the marketplace is open. You need to know that now so you can prepare yourself for Monday, Tuesday, Wednesday, Thursday, Friday. So I just wanted to share this information. Again, the marketplace will open Monday in 36 states. The states that we have with FRW Solutions, Michigan, Ohio, Texas, Virginia, South Carolina, all are marketplace states. Additional 13 states and the District of Columbia operate their own marketplaces and will open new enrollment periods too, right? And then the special enrollment period was authorized on January 28th by executive order by President Biden. It's those bees. So I'm serious. I was like, Obama, and then you say Biden. So just to read this real quick, a 4-month-long special enrollment period for the insurance marketplace opens on Monday in 36 states that use healthcare.gov for the Centers of Medicaid and Medicare programs. Another 13 states and the Districts of Columbia will operate their own marketplace websites and are expected to open new enrollment periods during their special health emergency, which was authorized by a public health emergency that was authorized by President Joe Biden on January 28th. Now, again, the special enrollment period gives Americans who need affordable quality healthcare coverage an opportunity to get covered. We encourage folks to head to healthcare.gov on Monday to explore their options, says HHS Acting Secretary Nicholas Corain, in a media release, right? They can also come to MRW Solutions and set a healthcare appointment, and we can do that for them, right? On Monday, CMS will launch outreach efforts that will include a broadcast, radio, and digital advertising touting the ACA's affordable coverage and premium assistance for families in need. And that is the subsidy part, right? That's the subsidy that help you pay for healthcare. Depending on your income, you can get, any big subsidy, the large subsidy or medium subsidy. A lot of people don't know that they can even get subsidies, but they can based on their income, right? Again, it talks about where customers can visit to view plans and prices in a row and invest plans for their needs. You can also visit us at MRW Solutions. We can do that for you. You can call us too, 734-328-3025, right? So that's, I just wanted to make sure I read this. This special enrollment period gives Americans who need affordable, quality health insurance an opportunity to get covered. And we encourage folks to head to healthcare.gov starting Monday to explore their options. I just wanted to reread that because it's really important. And again, we can also get you covered, right, at MRW Solutions because we are licensed health insurance agents. And we, again, can shop that marketplace for you because we're certified with ACA, right? Not everybody's certified with ACA. Make sure you know if the person, broker, or licensed insurance agent that you're dealing with is certified in ACA. Please know that before you give them anything, like even your name and birth date, anything, right? So last thing is I want to make sure that people who, and I should say 65, I hope it is, that we are going to be having a Turn In 65 virtual workshop event that's going to be coming up on February 20th at 3 o'clock. If you know of someone that's turning 65 in 2021, they can come to that event. It's free. We don't talk about any plans on that event. Just let you know, MRW Solutions is not affiliated with the federal Medicare program, or are we certified and represented. We're not doing that, right? But we are giving Medicare education through our sponsor that we have, which is Medicare Scholar. And education means we're just talking about the features and benefits of the plans. We are Medicare, not talking any healthcare plans. Okay, I always like to emphasize that because that's really important. Medicare education is Medicare education. It's not about plans for Medicare. Those are two different things. And honestly, anytime you have a Medicare education class and people start talking about plans for Medicare, that's a problem. That's bad for them. They should not be doing that. And honestly, you would want to leave because Medicare education is not healthcare plans. Two different things, right? So we're going to be having a Medicare education program. Again, it's free. It's going to be virtual online, right? Our sponsor is Medicare Scholar, and I'm really happy about that. And we're going to be talking about the features and benefits of Medicare. And if you turn 65 this year, please come. Or even if you're a little bit older than that, just come, learn. It's always good to learn information for you, right? Or if you know someone that is, and maybe it's your mom or dad or whoever, come still, and you can learn about it for them. So, which is awesome. You can also go on to our website, MRW Solutions Group, and I'll pull that up in just a second. So we have a special place on our website, and I'm going to get there. And yep, okay. So moving on, let me give you the website here. I think I am not sharing anymore. I pulled that one up, so let me stop presenting. And we will show you on our website where to go to sign up for this program, right? Free program. All right. I think you should be seeing it now. You will be seeing it shortly. And let me get out of the way here. So this is our website. You see a place on there that says Medicare 101 education. Boom, we just go right there, right? And you can go down to learn more about Medicare Turning 65 virtual workshop events monthly, right? You can go there. You can click this link, or you can go either one of these, right? We also have another one coming up on March 18th, but our one that's coming up on February 20th, click there to RSVP and join us, right? Join us because you're going to learn more about Medicare when you do, right? And that's literally what it is. So it's really easy. I'm really proud of our website. We had just did this update with the Medicare 101 education that we're doing with the MRW Solutions Group. So it just makes it easier to find it all in one place now. Yay! Okay, so that's that. All right, like I said, I was going to be short, so I'm going to keep it short. That's it for Are You Covered Enough? Special edition, I guess you want to go there. Again, ACA Marketplace open Monday. Get covered, get healthcare coverage if you have been laid off or you are not able to get coverage because of the fact that you have some type of pre-existing condition and can't get coverage on the private market. Get coverage. This is a rarity. It usually is not open after open enrollment with a special enrollment. Get covered. Your health care is important. Making sure that you stay healthy is important, especially during the situations that we're going through with COVID or whatever else you may be personally dealing with. Get covered. That is what we want to make sure to re-emphasize when we say, are you covered enough? That's what we mean with MRW Solutions Group and Are You Covered Enough program and podcast. All right, I'm out. So thanks so much. And I look forward to coming back. I think we're doing a pod. I think we were supposed to be talking about, let me see if I have it correct. We were supposed to be talking about life solutions, like life insurance and getting into the whole, one-on-one about that. So that's going to be a future podcast, probably coming up sometime next week. I would assume it's going to come up sometime next week. Maybe Thursday, maybe Wednesday night. But either way, we'll let you know, right? And Habs, I just love Habs TV. I always want to give a shout out because I would not know about this otherwise. To Revolution McGinney's of News @news4left on Twitter. That's how we found out about Habs TV, and we just love it. Actually, we love Habs. Thank you so much, Habs. I'm serious. I'm just really excited about it. I can go on and on, but I won't. All right, so let's go ahead and get ready to get out of here. Have a great day. Enjoy your Saturday. Hey, if you're somewhere near snow, stay safe, right? Be careful when you're outside, right? And try and stay warm because it's cold in Michigan. All right, see y'all later. Have a great day.